My name is Lizzy Fox, and I'm a legislative assistant for Representative Eric Swalwell. Thank you for the opportunity to speak with you all today about H.R. 5062, the Advancing Access to Precision Medicine Act. See that's, nope. All right, so on February 15th, 2018, about 2 weeks ago, Representative Swalwell introduced the Advancing Access to Precision Medicine Act. And so currently it was referred to the House Committee on Energy and Commerce, and as of last night, the text was not available on thomas.gov since it's so new. So if you have staffers asking for a text, feel free to give them my contact information. I can send it to them. The original co-sponsors include Representatives John Shimkus, a Republican from Illinois, Scott Peters, a Democrat from California, Eric Paulson, a Republican from Minnesota, and Juan Vargas, a Democrat from California. So we have a bipartisan bill, which is great. What does it do? The bill has two main parts, 3 sections, but 2 parts. The first part, Section 2, requires the Secretary of Health and Human Services to enter into an agreement with the National Academy of Medicine to develop recommendations on how the federal government may reduce barriers to the utilization of genetic and genomic testing. The report would solicit feedback from a wide variety of experts and stakeholders such as patients, patient organizations, health professionals, and the healthcare industry. A final report after 3 years would be submitted to the House Committees on Ways and Means and Energy and Commerce, as well as the Senate Committees on Finance and Health, Education, Labor, and Pensions. As you may know, these 4 committees have jurisdiction over different kinds of healthcare legislation. The second part, Section 3, would allow states to apply for a Medicaid exception to the Federal Assistance Percentage Map, known as the FMAP, to provide whole genome sequencing clinical services to certain children on Medicaid with unresolved diseases. So what inspired the bill? In his capacity as a congressman, Representative Swalwell has met with patients, healthcare experts, scientists, and many others who have shared their hopes as well as frustrations. It is an exciting time for healthcare. There are a lot of new technologies and therapies, yet many people still face barriers to the latest technology to diagnose and treat their diseases. Medicaid, Medicare, or private insurance may impede that access. Want to find out what's working, where are the gaps, what can be done differently, and what can be replicated. So almost a year ago, on March 7th, 2017, Representative Swalwell led a letter with 14 Democratic members of Congress to the Secretary of the Department of Health and Human Services. The letter asked for the department to take certain steps to study how the government may improve access to genetic and genomic testing, such as a National Academy of Medicine study. In the Secretary's response, he explained what actions the collective HHS agencies, like the Centers for Disease Control and the National Institutes of Health, are taking in the fields of genetic and genomic testing, such as roundtable discussions and other listening strategies. With the passage of the 21st Century Cures Act, strong funding for the Precision Medicine Initiative and Cancer Moonshot, and coordinated efforts among agencies, the federal government has taken bold steps to help advance innovation. The Advancing Access to Precision Medicine Act hopes to continue this bipartisan effort to transform our healthcare system and push forward the future of medicine. Thank you again for the opportunity to share more information about the bill with you. I look forward to your questions.